known for her dedication to women's reproductive health and her evidence-based Ayurvedic approach that delivers real clinical success. I take a pleasure in welcoming you, ma'am, and I like to hand over the session to you, ma'am.
Thank you, doctor. Shall I start?
Sure, ma'am.
Okay. Um, as we know that uh, in our country, not only in the country, in our all over the world, nowadays the rising point is IUGR. So the mother and the family and even from the society, the demand is only to get a healthy, nutritional baby. But there is a terms that where we are getting to get the nutritional high, which very healthy baby, where we are getting the failure, that is we are not going to concentrate on that. And if there is a IUGR, most of the time they will go for the kind of, if it is maybe there is a chances of preterm labor or there is a chances of fetal demise will be there, IUD chances will be there. So to avoid such a complications, there is a immediate the treatment is going to be has a emergency LSES, or sometimes it will be like a elective LSES. So instead of that going that we should know the about the pathology and the etiological factors and the mild and for the moderate on OPD basis and for the surgical basis, the what kind of the treatment can be approached to get a good healthy nutrition baby. So here in our acharyas also they says that the Shreyasi Praja is more important. Why? Because because the garbha is mainly formed by the four factors. Not only the four factors, even some acharyas they says that the Atma and the Panchamahabhutas and along with the Shuddha Shodita is also most indicated to get a Shreyasi Praja. So here Shreyasi Praja in the sense we have the person will be having all the qualities like all the shad bhavas, matruja, pitruja, atmaja, satvaja. So these all the bhavas along with pancha mahabhutas and shuddha shukra, shuddha shodita, atma, which is all are in satvaja properties and which will be having a good generate to give with the good have achievements to give the society and for the person which will have the good society knowledge and it will take the society into in a higher condition. So that kind of the Shreyasa Praja is needed for the society. So, but nowadays where we are lacking in is most of the time when there is a baby's birth is getting, we are telling that there is a IUGR baby. Baby weight is less, 2.4 kg, 2.6 kg, 2.1 kg, and sometimes it will be 1.5 kg. So, what is IUGR? Whether it is occurring preterm, late preterm, or in after the delivery or immediate after delivery or immediate after the delivery after like 1 or 2 days suddenly the weight reduction is going to losses. So we are going to discuss about this topic and what mechanisms are there and how can we treat with the Ayurvedic management to avoid the IUGR babies in a OPD basis. So I welcome you all for the today's topic. The topic is intrauterine growth restriction that will be called as IUGR. So, coming to the definition, the fetal growth restriction is said to be present in those babies whose birth weight is below the 10% of the average for the gestational age. So, means in around 32 weeks, the baby weight should be around like 2.6 to 2.7. So, here the 10% is going to be reduction. So, that will be around 260 grams is going to be a reduction will be there, so that will be going to impact on the baby. Means 260 grams in the sense the baby is 32 weeks. Here it looks like a around 30 weeks of the baby. So this will be the abnormal condition. So that's why they have particularly mentioned about there is a below the 10th percentile of average for the gestational age will be called as IUGR, or it is a fetal growth restriction. So coming to this IUGR is not only inside the womb. So it will be having in the preterm labor. So preterm labor means around 28 weeks, 30 weeks, 32 weeks or 35 weeks. So these babies will be having a less body mass index. So because of that also we will call it as a preterm baby. And in term baby also the IUGR is going to expect because of the some of the congenital anomalies or mother has having a, some of the habits or if there is any kind of maternal or the from the placenta or from the fetus side only, any kind of the abnormalities is there, the term baby will also gets the FGR. And in the post-term baby, some of the congenital anomalies are missed in the USG scannings and all. So, but after the delivery, we'll get to know that because of the any kind of the renal problems like hydronephrosis. So, these kind of the conditions, the baby is getting the kind of asymmetrical FGR. So, these conditions will be there in the preterm, term, and the post-term. So, coming to the incidence, as per the recent in 2024, there was one survey study has taken and they have written a book. So that particularly mentions that in India it is more severe number of cases are there in FGR. Means in all over the world, the India is very having a rich more cases of IUGR. It's mainly they says that it is mainly due to the nutritional and the mother habits. So coming to the types, there are two types. One is the symmetrical and asymmetrical. So in symmetrical in the sense which will be having more congenital anomalies, but in asymmetrical it will be having a dysfunctional. So the difference between the symmetrical and asymmetrical is here. So consider has a head here. So in this head you can see that the head is very small, and but in the asymmetrical the head will be in the normal shape. But here again there will be a body. So even the body and the head is very similar, means complete the head and the body is will be small in the symmetrical. But in asymmetrical, the head will be in big size and the body looks a small size. So that will be called as asymmetrical. And here the most common causes are like genetic, drugs, and the radiations. So, but here asymmetrical, there will be uteroplacental insufficiency like placenta previa, aproptia placenta, placenta circumvallata, or there is any kind of like congenital, like renal hydronephrosis. So these are will be having the most common for the asymmetrical IUGR. So here in this case, the BPD, that is biparietal diameter, and abdominal circumference will be normal, means from the head and the abdomen circumference the ratio, because they both are the head and the body is small size. But in asymmetrical, what happens here, the head size is big and the body is very small. So that's why here the BPD value is going to be increases, and the ponderal index will be normal in the symmetrical IUGR, but it decreases in the asymmetrical IUGR because here head is big and the body is small. So here coming to the cells. So in this symmetrical IUGR, what happens? All the cells, means the number of cells are going to decreases here, but in the asymmetrical, the size of the cell is decreased. So that's why it will be having the shape of the baby is going to be differs. And there is association like congenital anomalies, means single kidney, or there is a heart function dysfunctions will be there. So that will be comes under in symmetrical IUGR. But in asymmetrical, that's the most common cause is that is oligohydramnios. So why oligohydramnios is going to take place? So it's mainly due to the any kind of the placental problems. So placental in the sense circumvallata, or there is any kind of placenta previa or aproptia placenta. So there is a kind of the prognosis will be very poor in the symmetrical. Why? Because it will be not having, because the number of cells are decreased here, one thing, and it is mainly due to the genetic kind of the problems. So it's mainly defected from the chromosomal abnormalities. So that's why it will be very poor to treat. But asymmetrical, it can be treatable with exclusive breastfeeding and exclusive kind of the nutritional foods to the mother and to giving the good breastfeeding. So this asymmetrical IUGR can be treatable. So in this case, so it will be the etiological, coming to the etiological factors. So etiological factors are maternal, fetal, placenta, unknown. So maternal in the sense how the mother is going to causes the IUGR is mainly one thing is, one is having a small structure. So how small structure of the woman, excuse me. So here the small structure of the woman. Why the small structure of the woman? Because when she is, the height is very short, and when the conception has takes place, the increased size of the abdomen, which gives the exhaustion to the mother. Because of that, there will be having a shortness of breath, and if she is consuming a food also, she feels that abdomen is distended, and because of that, and there is a nausea, vomiting. So these kind of the secondary complications will be more. So due to that, there is a aversion to take the food, and there is a less of nutritional supplementary. It causes the IUGR. And if she is having malnutrition and low body mass index, because there is a decreased vascularity, so due to that, the placenta will be having insufficient oxygen to supply the fetus. So this will be also one of the cause for the fetal growth restriction. So coming to the maternal nutrition before and during pregnancy, the glucose and amino acids and oxygens are going to be supplied in very less in condition. So if a mother is having any kind of hypertension, or if she is a chronic smoker, or if she is a chronic drunkard, so in these cases, what happens? It goes to the cells will getting the oxidative, means oxidative stress will go, means the normal cell will be in the circular, but when it is oxidative stress, the shape is going to be changes. So due to that, the whatever the baby supplementaries, that will be glucose, amino acids and oxygen, it will be not supplying properly. So due to that, the body mass index of the fetus is going to be decreases. So in some cases like anemia, hypertension and thrombotic disease, heart disease, and the chronic renal disease and collagen vascular diseases, which will be having the same mechanisms, like which is not giving the proper nutritions, like the multivitamins, amino acids, and it's due to that the body mass index of the fetus is going to be decreases. So that's why the FGR is more common if mother is having a these kind of the systemic disorders, or is if she is a malnutrition, or if is a short woman. So toxins like alcohol and smoking, cocaine and heroin, so these will be increases the more oxidative stresses. So coming to the fetus, the fetal structure anomaly, the fetal structure anomalies like cardiovascular problems, means if the baby is having any congenital cardiac heart disorders, and if it is having a renal congenital, or like a chromosomal abnormality like trisomies, aneuploidy, and tripole, so or Turner syndrome. So if these conditions are there, so because the baby will be not having a much supplementary, means if there is a chromosomal deformity, there is a the lung is not going to be developed, the well match of the lung is be not going to develop, and the renal functions are going to be hampered. So due to that, even the fetus will be having the FGR. So coming to the infections, so how these torch agents are going to impact the baby. So here, if the torch, if a mother is a torched, infected, so it will pass the to the through the with the amniotic fluid. So due to that, the amniotic fluids will start to degenerate, means if it is normally transparent color, but when the torch infection was there, the color of the amniotic fluid is going to be changes. So due to that inflammatory changes, they will be having a inflammation changes, and amniotic fluid is will be having, there is a chances to get the rupture, and the preterm labor may take place. So in during that time, the baby's weight is not sufficient, so that baby will be called as fetal growth restriction. Or due to that amniotic fluid inside the womb also, sometimes what happens, it absorbs and it will be having dysfunctioning. So due to that, the baby will be not getting sufficient nutrition, so that will be also cause for the fetal. Then coming to the multiple pregnancy, so in twins pregnancy, one baby will be having higher demand and another baby will be having less demand. So because like in monozygotic, there will be a single placenta. So single placenta, if it is there, means it will be having a less kind of the supplementary to the one, it will for the one fetus, and another fetus will get good nutrition, but another one fetus will be having a less nutrition. So that will be also cause for the fetal growth restriction. So coming to the placenta, like placenta previa, abruptia, circumvallata, infraction, and mosaicism. So in this case, what happens if the placenta previa is there in the lower segment, and if it is completely covered the internal os. So due to that, there is a more, means the fundus will be it will be having a good nutrition, and due to that, the placenta previa, the increased vascularity changes will be there. So due to that, the lower uterine segment is going to be increases in the width. So, and because of that, the fetus will be having less nutrition because more supplementary will be in the lower uterine segment. So that will be one of the chance. And abruptia, so in abruptia placenta, the hemorrhage will take place in the placenta. So due to that, if one cotyledons has having a hemorrhage, it will start to get the inflammatory changes. So due to that, the pain will be there, the contractions will start, and due to that, along with the when the contractions are starting, and if there is a cotyledons are getting clots and hemorrhaging, so due to that, there is a vascular dysfunction will start. So the placenta is not getting the rich amount of the oxygen to supply the fetus, so again there will be a chances of the FGR. So coming to the pathophysiology, so you can see that the person, if is having a smoking habit, or there is any kind of stem cell therapy, and so these all will be having the main factors on the oxidative stress. So it means the small cells which will be having the shape of the cells are going to be decreases, and here there is a high mitochondrial activity of the placenta will take place, and due to that, it dysfunctions the intracellular leakage. So due to that, there is a chances of the IUGR will takes place, means it decreases the cell size and it decreases the number of the cells. So due to that, the fetus is will be not going to develop with the good body mass index. So here the pathophysiology is mainly that placental vascular dysfunction will take place, abnormal nutrient transfer, fetal response to abnormal or depleted nutrient supply. So that leads to the IUGR. So coming to the clinical features, the fundal height will be lag of 3 centimeter or more. And the Likert volume will be going to be decreases. Obviously, it will be oligohydramnios. And the symphysis pubis of the fundal height. So here what happens? So you can see the image here. So this is a week of 32. She will be near to the epigastria. So it will be a term pregnancy, but still the abdomen looks like a very tensed one thing, and the size of the abdomen is not like looks like a the period of amenorrhea. So here it's mainly due to oligohydramnios may be there, or it may be due to the IUGR also, or any kind of the pathology inside, means due to the placenta, or because of the oligohydramnios also the IUGR is going to be takes place. So here again, even the maternal weight. So especially for the pregnancy ladies during the ANC checkup, we are going to see the weight of the pregnant lady. Suppose if the weight is going to reduces, if she is around 63 kg. So normally in pregnancy, what happens, if it is a single fetus, around 16 to 18 kg of the body weight is going to be increases. If it is a multiple pregnancy, it will be like around 24 up to 24 kg is going to be increases. But if it is IUGR baby is there, the weight has going to be reduces. Means if her normal weight is already before conception, if her normal weight is 63, so she has to increase up to 10 to 16 kgs, means she has to increase up to the 79 kgs, but she is decreasing like more than the 63 to like 62, 61. So in this case, we have to suspect that there might be chances of the IUGR, because in Charaka he says that there will be a the pregnant lady gatra is going to be increases. So in this IUGR cases, it is going to be decreases. And abdomen girth. So you can see this. This is the abdomen. When you are going to see the girth of the abdomen from here, so here in this case, the girth of the abdomen is going to be will be having, means it should be in the pregnancy or in normal in first trimester it will be around like 35, but in the during the time of pregnancy it will be like in term pregnancy it will be around to 58 to 63. Suppose if it is very less in term also, if it is like around 44, 46, so that will be also called, it has maybe a chance of IUGR. So coming to the USG scanning, so how to define this IUGR? As a clinical aspect, we got to know by with analyzing of the mother weight, analyzing of the abdominal girth, and of the fetal parts is very visible, and the Likert quantity also, and of symphysis fundus height is also is going to be see the clinical aspect of the IUGR. But coming to the some of the investigations to rule out that the first main golden standard for the IUGR is USG scanning. So in this case, what happens? The head circumference and abdominal circumference ratio, if it is looking very similar and the body structure is not corresponding to the term pregnancy, then it will be called as symmetrical IUGR. But suppose, is it visible?
No, ma'am.
Okay.
Yes, ma'am. It's visible now.
So here in this case, even the femoral length. So here femoral length is also going to be decreases, and there is amniotic fluid. So there will be 4 chambers. So in 4 chambers, it will be less than 1 centimeter. Means it can be analyzed in the scanning. It is in a like 10 is one pocket, and the second pocket will be like 8 and third pocket will be like 2 So when we are counting, it should come as 10 to 15 or 10 to 12 centimeter. But suppose even the one pocket is less than 1 centimeter and all the 3 pockets also less than 1 centimeter. So what happens here? So it will be like around like 1 centimeter, means it will be like if it is 10 centimeter, means if it is having one pocket is 7 centimeter, second is also 7 centimeter, sorry, it will be like 2 centimeter, 3 centimeter. So the count is going to be where it's like around, it will be like 6.5 centimeter or 5 centimeter or up to 7 centimeter, even sometimes 9.5 centimeter is also considered as a IUGR. So how we are going? So in post term, so in the term pregnancy, if it is 9.5 centimeter of the liquor is there, there is a chances of the IUGR is going to take place. The liquor has reduced. So that is a to take the case for the elective LSES or induction of the labor. Suppose if it is a second trimester pregnancy, if the liquor is 9 centimeter. So what we have to do is we have to give the some of the medications, and we have to give like RG drug of the powders to swallow and all. So due to that, the fetus weight is going to be increases. So coming to the Doppler study. So in Doppler study, what we have to see is one is the uterine artery, uterine umbilical artery. So you can see this picture here. So in IUGR cases, there is only the single umbilical artery is there. So and there is no any, means here the 2 umbilical arteries should be there and one, sorry, single umbilical artery, uterine artery. So here the 2 umbilical arteries should be there, but there is a chances of one single umbilical artery. So this is a kind of congenital defect. So in these cases, so there is a chances of the symmetrical IUGR will be there, and sometimes if it is there is a kind of very short of the umbilical artery is there, then it will comes as a asymmetrical. And then later there is the absent or reversed end diastolic velocity. So here, if when we are going for the Doppler studies, we have to see the velocity of the uterine arteries, like diastolic, how much diastolic is there, how much there will be a systolic. So here diastolic in the sense means up to 10 mg should come here. So if there is a reversed, means it will be like around 2 mmHg, or it may it be sometimes it may be absent also, then it will be considered as there is a IUGR. It may be due to any kind of the notch or true knot in the umbilical cord or any kind of the uterine notch in the uterine artery. Then later umbilical venous pulsation. So we have to see in the Doppler study about whether venous pulsation is there or not, the continuous of the beatings are there present or not, that we have to see in the USG. And the middle cerebral artery is also going to go for the Doppler study, and ductus venous Doppler study should be done, and ponderal index is also going to be seen in the USG. So that's why if there is a IUGR you are going to suspect in your clinical examinations, then immediate action is to be taken with the USG. So after the USG also, if you are having some still doubt whether it is a symmetrical or asymmetrical, or whether it due to the congenital or any kind of the defects, then better to go for the blood test of the PAPA A, that is pregnancy associated plasma protein alpha test. So this test will be going to tell you as to what is the main cause. Is there any chromosomal defect has causing the IUGR? So then coming to the complications, there will be two complications, one for the fetus and one for the maternal. So here in the fetus, what happens? There is a immediate for the IUGR is asphyxia. So here mainly there is a dyspepsia of the bronchopulmonary, means in the bronchos. So there will be having a complete constriction. So due to that, the baby will be having asphyxia, and then later hypoglycemia, because it is the baby is not getting a good nutrition of the glucose. So that's why there will be a hypoglycemia is going to take place, and then later meconium. So when the baby, you just feel that if the baby, when you are going to squeeze your face, so you'll be giving the pressure into the lower abdomen also. So same thing when the baby is getting asphyxia, the baby will be start to go past the meconium. So once the meconium has came out from the fetus, so it will be going to spread in the amniotic fluid. So that amniotic fluid the baby is going to consume, and because of that the fetus will be having inflammatory changes, and there will be a chances to get the fetal asphyxia. So due to that, to avoid also the emergency LSCS is also going to be takes place. And there is a microcoagulation leading to be DNC and hypothermia. Means after the delivery, the baby will be having less body mass induction. So due to that, when you are going to expose the baby into the environment or the normal room temperature also, the baby will start to hypothermia. Means hypothermia, how you are going to identify? With the goosebumps. So how we are getting the goosebumps? So same way in the small babies, when they are going to expose with the room temperature, suddenly their thigh muscles and the leg muscles will be having a kind of goosebumps. So this can be correlated with the hypothermia, and pulmonary hemorrhages will be there because of the bronchospasms, and there is a polycythemia, anemia. So especially if it is having any kind of liver problems, and thrombocytopenia, viscosity like thrombosis, like if it is having a collagen disorders and all, and there is a intraventricular hemorrhage, electrolyte abnormalities will be there, and multi-organ failures will be there. So increased peritoneal morbidity and mortality will be there. Means if it is a baby has consumed the meconium, so baby will be having continuous asphyxia. So due to that, what happens? The bronchospasm will takes place. So due to that, the baby will be having fetal. Means it gives the pressures to the fetus cardiac output. So it will be the fluctuation will be there. Suddenly there is a rising of the fetal cardiac activity, then suddenly it decreases. So slowly it is going to decreases, and there is a chances of the IUD also going to takes place. So that's why we have to take care of the IUGR babies as very like a very preciously. So coming to late complications. So late complications like, so if the baby is IUGR, so what the mother will do, they will give the exclusive breastfeeding, and again they will give the multi nutrition supplements. See, so suddenly the obesity will take place. So due to that obesity, there will be chances of the diabetic, hypertension, or coronary heart disease, because the body heart is has decided that if your weight is 53 kg, so the body heart is completely adjusted to your 53 kg, or suddenly in a week if you are going to gain 10 kg, so it will get the cardiac output pressure. So due to that, there will be chances of hypertension. So increased blood pressure will be having the neighborhood diseases like diabetes also. So here there is a more chances of the adult life will be having more complicated for the IUGR babies. So the management will be can be taken as if it is in a first, if it is in second term, you have late second term if pregnancy. So you have diagnosed with IUGR. So what you have to do is, whether it is, you have to see that what is the causative factor first. If the causative factor is oligohydramnios, then you have to start with the Argipreg or Jivante Adhigruta, or the bed rest, and lack of lot of water in content of the foods like muskmelon, watermelon. So these kind of the foods we have to tell. Suppose if it is due to anemic, the patient is getting IUGR. So what we have to do is, we have to go with whether IUGR is normally megaloblastic anemia or macrocytic, or if it is any pathology is there, or any thrombocytopenia is there. So we have to go with the iron profile of the mother. So we have to identification the anemia, which anemia. So according to that, we have to give the treatment. Like oral medications is needed, or injectable is needed, or any transfusion is needed. So on that basis, we have to give the treatment. Suppose if it is having a kind of hypertension, suppose if a lady is hypertension, so because of that the baby is getting IUGR. So where the fluid is going, it is going on the legs, so that's why there is a edema. So here the first treatment is to reduce the edema. So like Punarnava Mandora or Lasix we have to give, and antihypertensive drugs has to be given. If it is a mild, the oral medications we have to give in a minimal dose. If it is a moderate, same the oral medications like Labitol, Tepin, or these has to be given. And if it is, the doses can be increased on the rate of the hypertension. Suppose if it is a severe, then immediate emergency of the LSCS has to be taken. Why? Because if there is a severe hypertension, you'll be having a chances to go for the mother and the fetal complications. So there is a chances of the demise of the fetus, and the mother is going to be die. So to save both or any one among them, we have to go for the emergency LSCS. If the fetus is also around like 28 weeks also, we have to go for the emergency LSCS. Why? Because there is the, after that, if the hypertension is not going to be controlled, there is a chances of the eclampsia. So due to the eclampsia, what happens, the uterus will be not going to be contracted. So due to that, there is a chances of PPH. So increased PPH may leads to the it may leads to the mother to get go for the hypovolemic shock. Suppose the fetus is in the womb, inside the uterus only, and she is getting eclampsia. So due to eclampsia, in the sense, when the patient is getting eclampsia or conversions, so the body will be very rigid. So uterus is a muscular organ. So even the muscles are going to be rigid, in the sense it will compress the fetus and the placenta. So due to that, the placenta is going to be separate. So this diaphragm, sorry. So you can see here. So here it is going to compress. So it will be going to compress, and due to that compression, the fetus will be having to get their demise, or once the placenta has started to de-separate, or apraxia placenta is going to take place. So due to that, there is the fetus sudden IUD is going to be takes place, and due to that, there is a septic shock may takes place also. So to avoid such conditions, we have to go for emergency LSCS. Suppose if the lady is having diabetic or polyhydram diabetic, and but still there is a IUGR is there. So what we have to do is, we have to give the minimal oral medications, then later moderate. But if it is very severe, we have to start with the insulin. Again, still after that also it is not there, then we have to go for the emergency LSCS. And suppose if there is a oligohydramnios is there. So in oligohydramnios, we have to give it the RG blood. So if it is very severe oligohydramnios is there. So what we can do is, we can go for the kind of IV infusions. So infusions, in the sense, we have to give the like RL or DNS or dextrose. So these kind of the IV fluids we have to give to the mother. So because of that, there is a, we can extend the delivery date to her, and it will be having a good chances. If the fetus is not getting a good nutrition, at least we can manage. So this IUGR can be correlated with the Garbhashosha, Upavishtaka and Nagodara. So as we know that about all these Garbhashosha, Upavishtaka, Nagodara, but I'll just only come the point with the Samprapti. So how this going to act? So there is one quotation is there, Nahi Vata Truto Nari. Means in Nari, without the Visheshan of the Vata dosha, there is no any diseases are going to be occurs. So here for all the any disease, the dominant doshas will be always Vata. So it will be associated with the three doshas. So here dusha is rasa and rakta. Why it is taken as rasa? So here from the garbha is mainly formed by with the rasa of the upadhatu of the artava. So if the rasa is not properly nourished, so there is a not chances with the rakta. Rakta in the sense here, the placenta can be taken here. So they are not completely properly well nourished. So the rasa is infected like oligohydramnios. Rakta in the sense abruptia placenta or placenta previa or circumvallata or mosaicism. So these kind of the dushyas will be can be taken in the under of the rasa in the rakta dhatus. So here srotas are like rasavaha and raktavaha srotas. The same has because the fetus is getting the nutritions, the all the amino acids, oxygen, glucose can be taken as rasavaha, and raktavaha in the sense it's coming through the bloodstream, so that's why it will be taken as raktavaha. And the adhisthana is in garbhashaya and the roga marga is abhyantara. So here the chikitsa. So how we can treat the treat the IUGR? One is on the OPD basis with Shamana Aushadhis, even IPD basis with the Shamana Aushadhis, and immediate action or time to call. So on OPD basis means, so consider has the patient, just imagine now the patient came to your OPD. So when the patient is coming, you have to see the what is the abdominal size, and after that you have to check with, one is the BP and second one is the weight of the mother. So once you are going to see the weight, you have to see with the LMP, means that is the last menstrual period, or whether she is the near to the amenorrhea period or not. Suppose if she is not there, so you have to ask that how many weeks is going. If she is telling that 34 weeks, but the fetus, the abdomen looking like a 28 weeks, so she's a 32 weeks and it looking like a 28 weeks. So this will be like, it is not like to be like a too negligible. So in these cases, what we have to do is for the 3 to 4 days, we have to keep in a IPD section and we have to tell her to do the bed rest. So every day we have to check. So followed with some of the medications we have to give. So without that, we have to go for the some of the clinical examination. So after the clinical examinations of the abdomen girth is 28 weeks only, and if she is having, there is a liker, means along with the USG scanning, liker is less. Now we have to start with the treatment. Like we are giving the treatment as initially in the Vyadhi Pratanika Chikitsa. So we have to increase the liker, but we don't know still that why the liker is going to reduce us in the Doppler study. So this is only USG. Again, we have to send for the Doppler study why it is happening. Suppose we got to know that is there any uterine notch is there, or any uterine artery, any kind of the diastolic sounds are absent. So in these cases, what can means what kind of the treatment can be given here? One is on, the first thing is bed rest. Then second thing is we have to keep her mind is very calm, and there is we have to tell the even the family members to do not to stress the mother, one thing. Then after that, if there is a, it is mainly due to the arteries related to the placenta. So what we can give is internal medicines we cannot give in the pregnancy, like more higher doses. So on abdomen, as through the Ayurveda, what we can give is, one is the like Mahavishnu Taila. It should be dipped in the gauze spaces. Means the gauze space should be dipped in the Mahavishnu Taila. And of the Punarnavakwata. So that gauze piece has to be kept on the complete of the abdomen. So due to that, what happens? It absorbs and it will be having upasneha and upakleda properties. So due to that, whatever the notch is there, it will be continued, but it is not going to affect on the baby when we are keeping the continuation of the pichu, means on the abdomen. We have to keep the dipped gauze pieces on the abdomen. So due to that, there is a less chances to get of the uterine notch complications, one thing. Suppose it is only the normal oligohydramnios is there, then what we have to go is, we have to go for some of the investigations like torch investigations. So if the torch in among that, if anyone has got infected, so what we have to do is, one, we have to give the antibiotics. So along with what we can give is, one is the Lagumalini Vasantarasa and the Ashtimadu Siddha, and what we can give is Sapta Dhatu Vardaka Ahara. So here we are giving only treatment on the fetus. So why? Because the nutrition, means how the baby is getting well nutrition, it will be having the able to chances the production of the amniotic fluid. So due to that, there is a less complications, we can regret it. So that's why here the drug of choice can be taken as Eshtimadu Siddha Dugdha and the Saptadhatu Vardaka Ahara, and there is a Lagumalini Vasantarasa. Suppose there is no any torch infection is there, only oligohydramnios is going to take place. So due to any kind of the stress and all. So here the yogas, kind like pranayamas, we have to intact, and fetal educations with music therapies that we can give. And later that what we can give is ati brahmaniya, means which causes the good sleep. So kind of the brahmaniya dravyas, ahara and vihara, like eshtimadu payasa, or the yoga ratnakara has told, no, some payasas we have to give. So that payasa which induce the sleep, so that kind of the medicines we can give. So along with here the best choice is brahmi vati. So this brahmi vati, it decreases the stress content, and it will induces the sleep sometime. So it will calms the mind. So because of that, when the patient is completely on the bed rest, there is a to avoid the kind of the chances. So along with this, we have to give the internally Jivantyadi Gruta or Vidhari Gandhadi Ganas Kshirapaka. So due to that, it increases. So how it is going to increases? Because it will be having the Vidhari Gandha Gana and Jivantyadi Gruta, which will be having the more, like up to 97% will be having Madhura Vipaka. So it increases the Upasnehana qualities. So due to that, the fetus will be getting well nutrition. So in coming to the modern mechanisms, so it will be having a kind of the more antioxidants. So more antioxidants in the sense free radicals. So free radicals, it will breaks the obstruction of the damaged cells, and it gives the good nutrition to the cells. So that's why there is a increased number and size of the cells is going to increases. So that's why the best choice is the in case of oligohydramnios to avoid the IUGR is it will be Jivantyadi Gruta and the Vidhari Gandha. And even the Shatavari Gruta is also can be given. And Vacha Gruta, here the vacha in the sense it will comes in Unmada Apasmara Adhyaya. Yeah, of course we can take, but here vachagruta is mainly given to avoid any kind of antimicrobial. So it is a good content for the antimicrobial, like torch infections is there, or sometimes if it is any kind of candida infections is there. So due to that, there will be a chances of the more bacterial infections. To avoid that, the vachagruta is the best for the antimicrobial. So it instead of giving the inflammatory changes in the uterine walls, it will going to nourish us, and it will be avoids the complications from the IUGR, later complications also. And the combinations like Mahapaishachika Gruta and Ashwagandha Ghambari Eshtimadu, Shatavari Guduchi. So these will be having rich contents of flavonoids and tannins. So flavonoids and the tannins will be having a good antioxidant content. So this will be going to helpful for the to increase the size of the fetus. So and the combinations, suppose if it is mother is hypertension. So Ayurveda management can be given with if it is very mild condition. So the BP is like 140/90. So it is continuously. So patient comes to your OPD and you have diagnosed hypertension for continuous of 1 week, morning and evening, her BP is 140/90, but it is going to be untreatable after taking medicine. So you can add with Divya Mukta Vati. So it will be having 1 BD after food, or Chandra Prabhavati. So these both drugs combinations, it will be going to decreases the cardiac output. So once the cardiac output is decreased, the fetal circulation is going to be balanced. So due to that, there is a less chances of the IUGR will be there. So coming to the moderate, if the BP is like 160/100 or 170/110, so along with the allopathic medicines like Labitol, Tepin, so along with this, what we can give is Gokshura Kshirapak. Why? Because it is a kind of Mutrala, so it decreases the cellular edema and the swellings in the edema, swellings in the legs. So it will be going to helpful, and mainly it acts on the vascularity. So even the Punarnava Mandora is also, it decreases the cellular edema. So that's with the will be the drug of choice will be like Punarnava Mandora and Gokshura Kshirapaka. Suppose if it is a very severe, so the continuation of the monitoring should be done, followed with the allopathic medicines, and along with the even some of the So here we can go for with the abdominal. So what I told, no, we have to keep the Gospis on the Mahavishnu Taila or Jivantadi Gruta or any Mahanarayana Taila, or if it is sometimes Dhanvantram Taila also. So you have to keep all over the abdomen. Why? Because they will be having cellular edema, not only in the legs, even the uterine wall is also having, even the abdominal wall is also getting the cellular edema. So to avoid that, all the edemas, so we have to go for the kind of abdominal pitchus can be given. And if it is very severe and it is not controllable, then immediate action is emergency LSCS, we have to go. Suppose if it is anemia, so in anemia is causing means the drugs choice will be like Datri Loha, Punarnava Mandura, 4 blood syrups, and the Eshti Madhu Kshirapaka. You can give with Eshti Madhu tablet or Ganavati, or Eshtimadu Kshirapaka or Eshtimadu Chuna also can be given. The drug of choice is be according to the pregnant lady's consumption, how she is going to consume. So here the Atriloha is mainly, it increases the hemodilution. So due to that, the HB level is going to be increases, and the Punarnava Mandura is also having the hemodilution, and 4 blood syrups. These all are having antioxidant properties, so it will be going to increases the hemodilution. So due to that, the patient will be having a good HB balance. And if it is after giving this also, if she is not having the anemia is not going to, then we have to go for the iron profile. So after iron profile, if it is a megaloblastic or thrombocytopenia, then the choice of the drugs will be like FCM injection up to 500 to 1000 mg we can give. And if it is need of blood transfusion also, that we have. And some of the oral medications like Orofor XT, or there is a Folix XT. So these kind of the medicines to be given to avoid the IUGR. Suppose if it is mainly occurring from the mother side, from the nutrition. So here the per day we have to give the 300 calories. So 300 calories in the sense there is a rich the carbohydrates. So this carbohydrate produces more glucose. So this glucose will be converted into further, it reduces the hypoglycemia of the fetus. So that's why there is a 300 calories of the carbohydrates can be given. And here there is a Garbhashoshahara Dravyas. So like Eshti Madhu, Sita, Gambari, Sariva, so which will be having more rich content of the flavonoids and tannins, and they will be having antioxidant properties. And Eshti Madhu Kshirapaka, Eshatavari Leha, Kushmanda Avaleha, so it will be having to increase the cellular size. So that's why the drug of choice can be taken here. So others IUGR, like in case of circumvallata placenta. So in this case, we can give the Matravasti with very less dose, like 20 ml or 15 ml of Matra Basti. 1 5, that is 15 ml and 20 ml of the Matra Bastis can be given for continuation like 7 to 8 days. So because of that, what happens? It gives the placenta is getting insufficiency. So to avoid this insufficiency, and it increases the new cells, it regenerates the new cells. So that's why the choice of the drug can be taken as Mahavishnu Taila, or even the Jivantadi Kruta also can be taken here. Suppose if the fetus is having a renal problems or anomalies, so here the Lagumalini Vasanta Rasa or Brihat Vata Chintamani Rasa can be given here. And if it is due to more Vata Dushti, so the cause is very unknown. So you can correlate with the Vata Dushti. So in this case, Mahavishnu Taila and Mahanarayana Taila, either you can give with the normal continuation of the body Abhyanga, or in the Matra Basti formations, or in the abdominal pichu, you can give with this drug of choice. So this is one of the case. This is my nephew only. So he was very malnourished, so due to the renal hydronephrosis. So due to that, you can see this his thighs. So here it is completely IUGR, means he is a case of asymmetric IUGR. So head is big, but the body mass index means the complete body is very less. So in these conditions, we have given, means after the delivery also, the mother we have given with the Jivantyadi Gruta and with the Eshtimadu Kshirapaka. So due to that, exclusive breastfeed helped to gain the weight within a month. So when he was birthed, he was around 2.3 kg, and now he is turned to 3 kgs. So even not only the fetus, we can give the treatment to the mother even after the delivery. There is no need to get panic or to be hurried that our baby is not getting sufficient nutrition. So in this case, what we have to give is, for the mother we have to treat. So if we are giving treatment to the mother, so like sarvadhatu pushtikara aharas, and we have to tell to avoid the like katu and ushna amla aharas and all, and good sleep, so it will gives the good breastfeed. So good breastfeed will be having the good nutrition. So he turned up to the 3 kgs. So the conclusion is only, if any cases are coming, don't be panic. So take your time and get read the pathology and identify the causative factor. On that basis you can give the treatment. If it is initially, it is going to get a time, but at the time of the point where you have to treat on the day, you will be going to be succeed. And but if we know that the pathology and the causative factors on which basis we have to give the treatment, then definitely IUGR babies can be going to turn. And moreover, for IUGR, we should not treat the babies. We have to treat the mother, because the mother is having the giving the nutrition to the baby here. So here always we have to tell the mother to follow the Masanumasika Paricharya, means Ahara, Vihara. It is not only about Ahara. We have to tell about the viharas to go to avoid the mobile phones, to avoid the workings, to avoid the stress, and to ati chankramana. So whatever the garbha vyapat nidanas are there, no, so we have to tell the lady to avoid these all the ahara and vihara paddhatis, then only we can be going to success. So in later days, like around 2030 or 2035 years, the India's ratio has to come down from the IUGR. So this is my topic. So I'm going to conclude. Thank you, one and all. Thank you, Dr. Shrishal, for giving me an opportunity to share my knowledge. Thank you.
Thank you, ma'am. And we are now open for question and answer session. Participants, if you have any doubt, you can unmute yourself or you can type your questions in the chat box. Ma'am, one of our participants has asked a question that diabetic with IUGR treatment.
Diabetic with
IUGR treatment.
See, in diabetic means again you have to go with, if the HbA1c is 6.5. So what we can give here, we cannot give the Kshirapaka and all these treatment. So instead of that, you can go with the Ruksha Aharas. Ruksha Ahara in the sense which will be having roti, that ragi malt. So in these cases, one with the food, it has is going to be balanced. Another one is the with the treatment, in the sense here the treatment which will be having the tikta rasas. So here the tikta rasas can be taken as like even the vidhari ganas or the gokshura kshirapak or gokshura kashaya. So instead of the kshirapaka, you can go with the gokshura. Suppose on that, along with, if it is 6.5 is there, you have to start with the even with the glycomet, because there is a chances of the hypoglycemia is going to take place. So instead of going the fetal demise, you can follow with the both the medicines. Here gokshura kshirapaka can be given in 50 ml morning, sorry, gokshura kashaya can be given in morning 50 ml and evening 50 ml. So it increases the mutrala. So due to that also the excretion will be more. So it will be having 6 point mix. The sugar level is going to be balanced, one thing. And the glycomet is mainly to give to avoid the hypoglycemia, one thing. And another drugs like Chandraprabhavati is also going to act, one thing. And the main thing is here we can give with a combination of the Bala, Guduchi and Gokshura. So instead of giving only Gokshura, we can give with the Bala, Guduchi and the Gokshura also.
Thank you, ma'am. And we have another two more questions. That one is asking Pathya during diabetic case with IUGR.
Patyas, like in the senses, can be taken as one is the Ahara Patya and the Vihara Patya. So here Ahara Patya in the sense to avoid, to better here, you should not avoid or skip the meals, like in the morning, in the afternoon and in the evening time. So in here, what you can go for, normal like green vegetables, Patya Ahara, like green vegetables like mente and the Sabbaski. So, and along with, you can go for this normal, like carrot salad, or there is a kind of sports, and so these kind of the foods can be given in the ahara. So if you are taking a ragi malt and all, you can add all the vegetables. So that will be also one of the good. But you should not add any kind of the milk in that, or buttermilk. Or so instead of that, you can make for the soup. This will be for the morning. For afternoon, you can go for with one of the rice, we call it as nauni. So that if the patient, because we cannot avoid the rice, so instead of that rice, we can give with the nauni. And for the night, again we have to give the early dinner. We have to prepare. So in that, we have to go for with the kind of roti and with the more green vegetables. So along with, even go for the fruits and all, in the sense we have to avoid orange. So and we can go for the normal, like apple, and some of the fruits, like any seasonal fruits, muskmelon. If they are taking, it should not exceed more than 300 calories. It should be like 150 calories only we can give. And coming to the viharas, the proper bed rest and proper walking and stress to be relieved. So this can be go for the diabetic as patya ahara in vihara.
Thank you, ma'am. And the other question is, ma'am, can you please tell more about Mahavishnu Taila and its mode of action with Punarnava Kvata as Uddara Pichu?
Mahavishnu Taila, it is mainly mm, like in Mahavishnu Tailas, there will be all the drugs will be having flavonoids. Flavonoids in the sense which will be having a free radicals. Means if there is, you just read that if there is any obstruction is, the cell will be circular. So if it is completely dried, means just consider if it is normal earth, if it has gone completely dry, you will put some water. So how it will become, the soil will become soft. So same thing here, it acts as an antioxidant. Means when there is a additions or scar marks is there, or inflammatory changes are there. So due to that, the cells are going to be damaged. So in that, if you are putting a Mahavishnu Taila on the abdomen, so from the skin too, so it will start to absorb. Means the cells will always start from the skin only. So it will go into absorption. It's not like a 1 day or 5 minutes or 10 minutes. So it should be like around 1 hour or up to 3 hours. Then only it is going to absorb. So how it is absorbing means it will go slow down the cellular edema on the abdomen. So there is it acting as an antioxidant. Means it breaks down all the obstruction of the cells, so it increases the regeneration of the cells. Then later it goes to reaches up to the, so due to that, all the cellular edema is going to be decreased. So it acts on this will be under the Mahavishnu Taila, or any Tailas you can go for this. And Punarnava Kvata, so Punarnava is one of the Mutrala. So Mutrala in the sense, it is going to vanish all the cellular fluid. So here the cellular fluid, if it is increased cellular fluid in the sense, cellular edema. So here the cellular edema, to get rid of the cellular edema, the Punarnava Kvata is best benefit. So here don't consider as Mutrala in the sense it has to come through the urine. So it is not like that. Even the excessive sweating is also can be taken as a Svedana. So the Punarnava is also acting as one of the Svedana property, Kledahara property. So here the Kledahara in the sense it is going to excrete all the cellular edema either through the skin, either through the urine. So if you are giving internally, it will come as a Mutrala. If you are giving on the external, it will come as around the Kledana, like in the sweat property. That's it.
Thank you, ma'am. And Sandhya ma'am is asking that cholelithiasis in pregnancy, is it common, ma'am?
Which one, ma'am?
Cholelithiasis.
Cholelithiasis.
Cholelithiasis in pregnancy, is it common, ma'am? If so, what might be the line of treatment?
So first of all, the cholelithiasis will not come after the pregnancy. If it is coming also, So there is early detection, because the most of the time the girls will not go for the USG scannings. So when there is a conceived, after that she will get to know that there is a cholelithiasis. So in these cases, the gallstones will be like it will be having a complications. Why it is? Because it is getting the, from the abdominal pressure. So due to that, there will be a chances of the extremity of the pain will be there. So to avoid this extremity pain, we have to go for that. What is the size is there? One thing, whether it has to be operated. So here, mild, moderate, and severe. So if it is very mild, so we can go with the treatments like kind of the here the treatment has to be given in the always in the kashaya. So kashaya in the sense here the vacha and vacha gruta or mahapaishachika gruta can be given as internally one thing, and then later the combination of the gokshura, punarnava, bala, guduchi, and even also can be given with dashamula kshira paka. Here dashamula kshira paka and erandamula and bala. So with these three combinations, it acts on the to avoid the mild to moderate of the cholelithiasis. But if it is very severe, so we have to go with monitoring with the laparoscopy. On this, we can go and go for the cholecystectomy. But it is very rare case. So if it is rare, that means there will be a guidance of the general medicine and the general surgeon only. They are going to take whether it is severe, what can be given. Then only they will go for the emergency conditions, emergency LSES, not emergency LSES, they will go for the emergency laparoscopy cystectomy.
Thank you, ma'am. And we have one last question, that how do we treat IUGR that has caused due to transfusion syndrome? One
Hmm.
person is nourished in excess and the other is relatively malnourished.
Yeah, this is a completely biggest task, because the one fetus in mainly twins transfusion, so it is mainly due to the kind of monozygotic. So in monozygotic, the both conditions will be similar, but the one fetus will be completely implanted. The placenta is very near attached to the fetus, so that's why it is getting. So in this case, what we can give is, if it is the more baby, you should not consider that if I'm giving a nutrition, the first baby is only getting more nutrition, again it will turn to, if it is 2.3 kg, again it will turn to 2.8 kg, but the baby will be coming only 2 kg. It's not like that. If the first baby is turning up to 3 kg is also okay, but second baby, whether the uh, IUGR, whether the growth is increased or not. Suppose, just example, that twin pregnancy is there. So first pregnancy is, the first fetus weight is 2 kg. And the another fetus weight is 1.8 kg in 32 weeks. So this is completely abnormal. So what we can give is, here the internal medications we have to start, like Eshtimadu Kshirapaka, and the stress is also in this case, because of twin pregnancy, more excretions will be there. So due to that, and more nausea, vomiting. So due to that, there is a more, the mother is will be having more to take the aversion of the food. So due to that stress, we have to can go for with the Brahmi Vati or bed rest and good music therapist. One thing that's that. And internal, we can have to give Eshtimadu Kshirapaka, Shatavari Leha, Allos compound, or Leptadine, or Kushmandala. So when we are giving continuation of these medications along with the good nutritional food, so here the baby, the first baby has raised up to 2.5 kg, and the second baby will be going to rise up to 2.2 kg or 2 kg. That is sufficient. At least we have crossed the from 1.8 to 2 kg. If the first baby is getting more nutrition, but the baby is lacuna between 200 to, or there is 200 to 500 gram, that is okay. But at least it has reached the from, it has came out from the boundary level, no, that is has to be done in this type of cases.
Thank you, ma'am. And we have uh, we have a question, that Mahavishnu Taila of which pharmacy will be good to use?
There are the Mahavishnu Taila, in the sense most of the pharmacies they will give Bala Vishnu Taila. So here the most question will be like whether Bala Vishnu Taila is only Vishnu Taila or what. So we can give the Vishnu Taila or not. They having. So here the Bala Vishnu Taila can be given. You can go with some of there is one famous pharmacy in there. Mm, wait, I'll tell you. It is from this. That is, I usually get it from our one pharmacy there in Lakshmi Ayurveda. So he is getting from the Mangalore, that is Mangalore store. From there, he is getting the Bala Vishnu Taila. And even the Baidyanath company is also good for the Mahavishnu Taila.
Thank you, ma'am. And Shubhashri ma'am was asking that, sorry, the other person is asking that IUGR can be considered as Apatarpana Vyadi. Can IUGR be considered as Apatarpana Vyadi?
Yeah, it can be considered as apatarpana because it will can be correlated with the Garbha Vyapat Nidhanas. If here the lady is following the Garbha Vyapat Nidhanas like Ahara Vihara, then it can be taken as a apatarpana Vyadi.
Thank you, ma'am. Any more questions can be asked. You can, our participants, you can unmute yourself or type your question in the chat box. Can we delay preterm in IUGR?
Pardon, ma?
Can we delay preterm in IUGR?
Can we begin preterm? I didn't get the question properly. Can we delay
Preterm in IUGR?
Here in IUGR preterm babies, if it is delivered and before like in around 32 weeks or 30, up to 35 weeks, it can be treatable or we have to we can wait for up to the delivery. So we have to see the causative factor. So in that treatment, if it is, we have to make the IPD section. So in IPD, we have to give the IV transfusions along with internal medications like Shrimadu, Jivantayadi, and supplementary with good foods and all. So along with this, we can extend the delivery date also. Means up to we can go take for up to the term pregnancy if she is getting the good results and the good weight is maintained. So that time and there is no and alternate scannings has to be done, and it's every after 2 days we have to go for the scannings whether the femoral length and head circumference and abdominal circumference is increasing or not. And if suppose if it is decreasing, then immediate emergency LNCS can be taken.
Yeah, I think our participants are done with their questions. As we have come to the end of today's enlightening session, I extend my heartfelt gratitude to our esteemed speakers for giving your valuable time to share such valuable knowledge and your experience with us, ma'am. Your explanation on the topic IUGR had truly enriched our understanding, ma'am. And I also wish to tell a special thanks to all participants for your active presence and enthusiasm, which made this session lively and meaningful. Once again, thank you everyone for being a part of today's program. Let us carry forward the knowledge gained and implement in our academic and professional journey. Thank you and have a great time ahead. Thank you so much, ma'am.
Thank you.
Thank you so
Thank you
much,
so
ma'am.
much, ma'am. Thank you, Doctor.
Thank you.